I perform a lot of both FUE and FUT hair transplant procedures in both men and women. A very common question I have is women come to me and they want to have an FUE hair transplant. I don't think it is necessarily wrong per se, but I don't think it is oftentimes the best answer for women for a lot of reasons. I think that women and men are both very susceptible to marketing tactics when people see horrible scars in the back of the head from FUT, but I've also seen horrible destruction of donor hair and hairlines through bad FUE procedures. But a question women always ask me is, I don't want a scar in the back of my head. Can you do FUE for me? And first of all, FUE is not scarless. It leaves little white dots. But I would tell you that for men, I perform many FUE and many FUT procedures every single week. Whereas with women, I almost exclusively perform FUT procedures or a linear strip procedure for them for a lot of reasons. And I want to go through some of the reasons why I think for women, it really makes not a lot of sense in the vast majority of cases to do FUE. There are probably some rare exceptions, which I can go through, but I don't want to make it more confusing for you. So FUE, as a summary, is harvesting individual hairs from the back of the head, and FUT is making incision and taking the hair out as a single strip. The reason I don't prefer FUE for women in general are the following reasons. First is you can do FUE through a no-shave technique where you don't shave it. But vast majority is shaved because it just takes 2 days to do FUE non-shaven approach. It can get very costly and exhausting for both the surgeon and the patient. Be in lying down in a prone position. In other words, their face in a cradle for 6 to 8 hours for 2 days. Just for that is a very long, tedious procedure, and the surgeon is there for such a long time, so the cost is very high. Just to do non-shave. A shave approach makes no sense for women because then you have to shave the whole back of the head to do this, and almost no woman would want to do that. It just makes no sense. But there are other reasons beyond the practical side points, but there are actually benefits to a strip procedure for women. First of all, the scar heals incredibly well for women, and even if it is widened by 1, 2, or 3 millimeters, the woman never sees it because their hair is never cropped military style unless they are in the military, and that probably would be an exception where FUE could work well for a woman if she is wearing a very, very, very short hairstyle. But that is almost never the case. The other reason is perhaps in certain African Americans if they're predisposed toward keloids. But to be honest with you, I do a ton of African American females. I've never encountered a keloid in the back of the scalp because I select my patients very carefully. But honestly, if they're already prone to keloids, FUE still can create a keloid, so I would not even operate on them. So in those cases, it makes no sense either. But I do an African American female probably every week to every other week at some level, and I don't do FUE cases in them. It just doesn't make sense to me. But let's talk about two distinct benefits besides not having to shave and having a much more comfortable experience during the surgery, a much shorter procedure. One is the fact that women's hair loss typically extends over the temples and over the nape of the neck and the top toward the crown. It's usually very confined to the occipital region, and so the benefit of doing FUT is you get the best quality grafts in an area of the highest density. Whereas if I do FUE, I've got to go and cherry pick all these grafts over a very wide area, and usually it's not enough grafts compared to doing the strip procedure in a very, very concentrated way. So it's a much higher, better benefit in terms of yield for women, especially if a woman has white hair, then FUE becomes incredibly difficult to perform. Also because those hairs are thin throughout the whole temple area. If you start taking FUE from the temple area, you're going to start having hairs that are more susceptible to future hair loss because those areas are more programmed for hair loss because women lose hair over a very wide area, including the temporal area. And to get enough grafts, you have to take them from a wide zone in the temporal area. So for me, it makes no sense for that perspective either. Another thing is a colleague of mine actually did a side-by-side FUE versus FUT and looked at the differences. And in quality, a hair surgeon's work, there's almost no difference between FUE, FUT between the two sides looking carefully. Of course, you could see a line if you get shaved down to, like a few millimeters, but beyond that, it's very hard to tell the difference between the two sides. But the one thing this gentleman, not a woman, this gentleman complained about is he said on the FUE side, he actually felt that the hair felt thinner, even though it didn't look thinner. You couldn't visibly see the difference, but it felt thinner. And women oftentimes complain of how their hair feels and the weight of how that layers, not just the way it looks. So this is a fourth or fifth or sixth reason why FUE doesn't make a lot of sense in women. So, of course, are there exceptions? Yes, I already enumerated a couple exceptions, but the vast majority, FUE for women, to me, makes not a lot of sense. And to me, it's a lot about marketing and hype that just, I think, really a patient should understand those details. And I can spend hours talking about this subject, but I think it's some of those things that you need to sort of avoid the marketing and understand why I do a certain procedure for women. And that's the thing is the vast majority of doctors, the reason why they offer you FUE today, because they don't even perform FUT. They're never trained to do it. They don't have staffing. They don't have equipment capable to do it. All they can do is FUE. So that all they're going to be able to sell you is the one procedure that they do. And I think this is a big issue. I'm writing a 2-volume textbook on FUE. Currently, my FUE book is the only FUE book in the world, and when this comes out, it'll be the only standalone FUE book, and double-volume book or single-volume book in the world. So I'm very passionate about the subject. I perform a ton of high-quality FUE procedures, but the biggest issue is that nowadays the surgeons are simply not even learning how to do FUT, and the problem with that is they're losing a whole side where women are simply not, they're not being able to get quality work because now everyone's being funneled through this one technique. So again, I can spend more time and talk to you about this if this doesn't make sense to you. You can jot some notes down of things that I may have gone over very rapidly, and I'd be more than happy to clarify it for you.